highlight the big problem with our healthcare system that you aren't hearing about while everybody's focused like a laser on the problems with the Obamacare rollout. Did you know that we have a serious labor shortage in the healthcare industry, one that's only getting worse over time? And that means there's an enormous opportunity in the healthcare staffing business. Which brings me to AMN Healthcare Services, AHS for all you home gamers. Here's a little $600 million company that happens to be the largest healthcare staffing and physician search that's important business out there. Plus, AMN Healthcare is what's known as a managed service provider, type of healthcare cost containment play, where hospitals let AMN manage all the business aspects of things so they can focus on delivering healthcare perhaps at a prudent and not that too expensive way. Plus, AMN has their own proprietary software platform that allows them to cut costs and improve efficiency for far better than any of the hospitals can. Company reported a strong quarter 2 weeks ago on October 31st. And I think the speculative healthcare cost containment name could have a lot more upside, although I have to ask, why hasn't the promise been realized yet, given the compelling nature of the investment and the demographic imperative it seems to have in its favor? So let's talk to Susan Salka. She's the president and CEO of AMN Healthcare Services. Find out more about our company and where it's headed. Ms. Salka, welcome back to Mad Money.
Hi, Jim. Thank you so much.
First of all, the president was on today. Spent a lot of time talking about it. I'm sure you're focused on it. Yeah. Any of the near-term fallout from the problems, are they going to impact your company?
You know, short-term, there are both positives and some negatives that affect our industry. On the positive side, we've certainly seen our clients and just healthcare organizations in general become much more focused on how they're going to manage their workforce going forward. And that's caused them to want to partner with organizations such as us who can provide workforce solutions, things like MSP that you mentioned, also recruitment process outsourcing. You know, there's some cost constraints on the negative side. Longer term, we definitely think it's going to be a net positive and provide a lot of opportunity for us to do some really innovative and unique things with our clients. And the great thing is they want that. They're hungry for it.
Now, why would they want temporary staff, which may actually short-term cost them more, when they could think long-term and hire doctors at arguably a cheaper price than they can get from you?
Well, actually, if they're looking at their total workforce cost, it's going to be more ideal for them to staff at the core staffing level at a lower level. So we actually hear many of our clients talking about taking their core staffing from maybe 90 or 80% down to 75 or 70% so that they can flex up when needed. And the uncertainty that we have around healthcare reform actually drives that desire to be able to have more flexibility. It also gives them greater access to a workforce that they might not have available locally. We have a network of clinicians, doctors, nurses, allied professionals all across the country. So we can tap into labor skills that they might not necessarily have available locally.
Can you tell me, you've got a physician permanent placement business that is incredibly strong. The big doctor shortage, you guys are an answer to that. Would you ever think about just shifting the resources to the hottest areas? Because I think some of your businesses are not as strong as that doctor business.
Well, you're right. We actually have two kinds of physician businesses. Our physician perm placement firm, we're the largest in the nation in providing retained search and contingent placement for doctors. And that business has been doing extremely well. It was up 9% year over year in our third quarter. And we don't expect that to slow down because the physician is still really at the center of patient care delivery, kind of like the quarterback. So we expect continued strong demand. But we also have our locum tenens or temporary staffing for physicians. And that's been in high demand as well. In fact, it was up 11% year over year. And with hospitals acquiring more physician practices and realizing that they really need to be aligned with the doctors, we see it as a tremendous growth area.
Okay, you know, you're talking, people think of doctors' steady need. They think of hospitals' steady need, but the hospital census, as you call it in your Q&A, remains weak. Do you expect it to pick up in 2014 because of the Affordable Care Act?
You know, longer term, absolutely. We think, and we hear from our clients that, in fact, we just did a survey of hospital CEOs, and over half said that they expect increased needs for physicians, advanced practice like nurse practitioners and PAs and nurses over the long term. And so we think there will be increased demand there. Shorter term, I think they're more cautious about where census will go. But that's okay. We can still be a valuable partner and help them to really get control and manage their total workforce cost.
Okay, Susan, one of the things that I love about your business. The long-term demographics are really great, but I'm trying to put it in context. When you came public, you were 25 on 11/29/2001, and then you spiked to 36 in June of 2002, 29 in 2007. But the promise hasn't been realized versus the history. What's the longer term that didn't go right that can go right?
Well, we do get affected by economic contraction. So as we hit the contraction in kind of the 2002-2003 area, we saw the business contract, particularly the nursing business.
Right.
And that's one of the reasons we've continued to diversify the business over time. When we originally began, we were a nurse staffing company. Today, we provide all kinds of clinical disciplines, and really, we become much more of a workforce solutions company in helping our clients to manage their total workforce costs, as opposed to just being that temporary provider.
Right. That's why I think it's such a better company now than when it started. Well, terrific. Absolutely. Thank you, Susan Salka. She's President and CEO of AMN Healthcare Services. Read the stuff. You'll see this is going to be a big start, I believe, in 2014. Stay with Cramer.